of the system's infrastructure is run down and old, and many facilities are inadequate. One example is the Gugulethu Day Hospital in Cape Town. My colleague, that's eNCA reporter Ronald Masinda, is there now finding out from health authorities and staff what's on their wish list this morning ahead of the Minister of Finance's budget speech this afternoon. Ronald, very good morning. I wonder what the healthcare workers in that particular hospital would like to hear from the Minister this afternoon. It's been a very tough year, and we're still very much in the middle of the pandemic, and of course we're all waiting for the vaccine rollout to proceed in the next few weeks.
This has been a tough year, Bradan, indeed, especially in this community hospital where a number of nurses have not only have to deal with hundreds of people who have to come here for medical treatment, but this actual facility has also been badly affected by a number of nurses who have contracted the COVID-19 virus, and this has meant that a lot of the work staff has been understaffed. And when we spoke earlier on to quite a number of patients, one of them is a patient that has been taking ARV treatment for the past 26 years. She says that she's been coming here now for several months and she has yet to receive the ARVs, and one of her concerns is that she has the underlying issues, health issues, and that should she contract COVID-19, this could mean very bad news for her. But we are going to be speaking to several people. The nursing movement will also be speaking to later on. But for now, though, let's bring in a community leader here in Gugulethu. Itumeleng, thank you so much for your time. We heard from the communications officer earlier on here, who doesn't want to speak to us on camera, saying that they are not understaffed. What are your thoughts on that comment?
My name is Itumeleng from Gugulethu Uprising. Into endibonayo apha nento endiyaziyo iDay Hospital iyashota ngestaff iDay Hospital. That is why ubona ku overcrowded ngolu hlobo apha ngaphandle. And we've been trying to engage with the management, especially Mr. Makamba, to have some meetings because of the stepping of people outside the hospital, the in-breaking of cars outside the hospital. But kuyo yonke lonto leyo Mr. Makamba akafuna usimamela, and I think Mr. Makamba kuzafuneka azithobe eze ebahlalini asimamele, because I believe mna into yokubana into yalapha ekhaleni ilungiswa ngabantu balapha ekhaleni.
Lastly, before we speak to another member who's here, in terms of what the people are hoping to hear from Minister Tito Mboweni when he makes his budget speech, what are some of the issues that he will need to address?
I think we've been having meetings with the member of the health forum yalapha Gugulethu. Noe knows everything about lento yalapha clinic, and into besicela we would like it changes zokubana abantu bahoyeke, because we've had several complaints ezisuka ngaphakathi kwabasebenzi balapha, the way abathetha ngayo i-patients alapha ekhaleni. So that is why sicela Mr. Makamba must come down to us and sit down and resolve issues ezenzakalayo apha esibhedlela.
Well, Itumeleng is saying basically, Bradan, in a nutshell, that a number of their calls as a movement here in Gugulethu have fallen on deaf ears. I'm going to bring in a community health member who is here, Mama.
Community health committee member who is elected by MEC, Noma French Mbombo.
All right. Mama, tell us just some of the claims made here, ill treatment by nurses to the patients. Is there any truth to this?
To the health committee side, that is not true. Point number one, if you can come around in this clinic about 12:30, all the people are saved. Ne? There are systems here which are producing here in the clinic, which is appointment system. If you wanted to come to the clinic, there is appointment system. If you didn't come for appointment, if you said you are sick, there are OPDs, there are triage. In triage, what they do, they take take a blood pressure, there are 3 colors of triage. They are yellow, they are green, they are red. If you are red, they won't let you go outside the clinic without helping you.
Just lastly, Mama, we're seeing a lot of people here complaining that they wait for hours and not go into the clinic. Is the clinic understaffed? What can be done better to assist many of the people, many of them old, many of them carrying infant children?
To the staff, to the community which is outside, we have 210 members which are employed here inside. Most of our employees, they were infected by COVID. That's why the numbers of the people are here outside. Therefore, this clinic is willing to assist the people. The only thing, we cannot bring all these people outside because we must practice the social distance inside. Further, each and everyone which is here outside, they will be assisted. And another thing, the people, they must understand, this is a primary healthcare system which is driven by his sisters. And the doctors which are here, they are here just because of the trauma.
Right.
The community, they must understand the primary healthcare system, they must not compare the day hospital as Grootsker. Grootsker is a tertiary hospital. This is a primary healthcare system.
Right. We get the idea. Thank you so much, Mama, for your time. Well, Bradan, we have to wrap for now, but also hearing from the old lady here saying that, this is a day hospital and many of the people coming here for treatment should be going to bigger hospitals. Now, what we also understand in areas such as Gugulethu and Nyanga and nearby, like in Manningburg, a lot of people who used to receive treatment used to go to facilities such as JF Jooster. Now that facility has since shut down, allowing a lot of people waiting here, many of them for hours. We're going to be continuing our conversations with a number of people. We'll also be speaking to Danosa later on, as well as some of the labor unions.
Thank you very much, Ronald Masinda. We'll catch up with you in an hour or so after 10 o'clock as we continue to build up to this afternoon's budget 2021. You're watching